Good evening, everyone. Thank you all for joining us tonight for the neighborhood update group. I think hopefully some of you were here. I think it was 2 weeks ago that we did this, and maybe came back for more this evening. I have also with me again this evening a special guest, which is Dr. Fred Echols. He is the head of our health department, and he'll be happy to take some of your questions, which are more medical in nature. I'll just begin by saying that thanking everybody for the job that you've done in tamping down the spread of COVID-19. We have, for the last few weeks, we have been seeing some improved results, fewer people getting sick, fewer people being in the hospital, fewer people on ventilators, and fewer people in the ICU. And so that, of course, was the point of this. I know that it has been almost 8 weeks that we have all been on a stay-at-home order. Of course, many of you have been staying at home, and some of you have probably still had to be going to work. So thank you, because both of those are very important roles. On Monday, the 18th, so just a few days from now, we announced last week that we are going to be cracking the door open for some businesses to reopen. And I say cracking the door open because we're not swinging it wide open. Restaurants will be able to open, retail will be able to open, but they both have many, many restrictions. The most important of which are in all cases, whether you work in an office, whether you work in a restaurant, whether you work in retail, everybody has to stay 6 feet apart. In addition to that, employees of these businesses will have to wear masks, and we all have a couple of masks here and a couple in my purse. So we're all wearing masks here when we are in the office, and so those employees will have to wear masks, and we are really strongly encouraging all of you to wear masks when you go outside. You just never know when you're going to be in a situation where you might be within 6 feet of another person, and it's just much safer for you and much safer for other folks as well for you to be wearing a mask. Of course, you got to continue to wash your hands, clean and disinfect work surfaces, all of those things, because even though we are cracking the door open on businesses, we have to go slow on this. We have to continue to be careful. The virus is still out there, and people will still get sick from this. So we have to take these precautions. It's simply a matter of making sure that we try to protect ourselves and try to protect other folks as well. So that'll be beginning on Monday. Now, just because you're allowed to open, if you're a business owner, just because you're allowed to open on Monday does not mean you have to open. That's totally up to you. You're in the best position to make that decision. I know many businesses that I've spoken with who do not plan to open Monday. They're going to take a bit of a wait and see approach. And I think that there's a lot of common sense in that approach. So you're not required to open. You may open as long as you have PPE, personal protective equipment, as long as you have the masks, as long as you follow the guidelines of social distancing. We did issue, and it's on our website, industry guidelines for each industry, for offices, for retail, for restaurant, for hotels, for transportation. There are 8 different sets of guidelines issued there to help you figure out how to reopen in a gradual way and still protect both yourself, your employees, and your coworkers. So I'll leave it at that. I'm sure that you may have lots of questions about that. I'm more than happy to visit with you about those. I know we have a lot of questions, right? So I'll just get straight to your questions, and then hopefully we'll get through all of them.
All right, so Mayor, we have a couple of questions that were submitted online through our Google form, so we'll get to those first. But for everyone listening, if you're an attendee and you want to ask a question, you can either use the Zoom raise your hand function, and we can do a question live on air, or you can use the Q&A function and we'll read those questions aloud. So with that, Tanya, if you want to go ahead with our Google Form questions.
Sure. Mayor, we have a question from Michelle S. from Tower Grove Heights. Michelle asked, how will businesses be held accountable for complying with the guidelines of the new order?
Thanks, Michelle. That's a really good question. You know, the businesses that I've spoken with, and I think most businesses will be trying hard to comply with the order. In the event that they're not, if you are a customer of a business, of course, if that business is not complying with the order, not wearing masks, not social distancing, I would suggest don't go. But I would also suggest letting us know, and you can call 622-4800. And the health department will investigate, take a look at that business, try to give them some help to bring them into compliance so that they can continue to operate. So whether maybe you're an employee of that business, you might want to talk with the employer and just make sure that they have read the guidelines that are online and are trying to comply with those guidelines.
Thank you very much. Next, Mayor, we have a question from Michael A. Michael's question is, will the city be enforcing rules for restaurants and bars the same or differently? What about hours of operation?
So restaurants and bars have the same rules and regulations. And I'm going to get my book here. I think I am. Let's see. What did I do with it? Well, here it is. I already had it over here. So this is all online. This just happens to be a printed copy, which, you know, I'm using as a reference. And there are a number of pages in here, a whole tab on bars and restaurants and what they have to do. And fundamentally, it's tied to social distancing and many, many cleaning procedures, monitoring of employees' health. There are procedures for staff arrival and departure, and there are a number of those. Procedures for restaurant preparation. There are a number of those, cleaning and sanitizing. So any restaurant and or bar has to follow all of those guidelines and those procedures as they apply to their particular business. And yes, we will be monitoring that.
Right there, we have a question submitted through Zoom. Sharon would like to know, when do you anticipate restaurants being fully able to open? We hear a lot of people who want to stay closed, but there are a lot of us in the city, maybe a majority even, that want the people who are concerned to stay home and the rest of us go out and drink. So again, when do you anticipate?
Say that again. There are a lot of us who want to what?
There are a lot of us that want to go out and have a drink or go out to a restaurant.
Yeah,
So
right.
when do you anticipate those restaurants being able to fully open?
Well, restaurants will be able to fully open with restrictions, if that makes any sense to you, on the 18th. So their tables have to be 6 feet apart. So people have to be 6 feet apart. They'll have to have some partitions. Maybe they have booths there. They would have to have a partition between the booth. So you will be able to go out to restaurants and bars, but you will have to socially distance. I mean, there's none of this, you know, everybody bunching up at the bar. That's not gonna fly. But certainly you can go out to restaurants beginning on Monday, those that are open.
Thank you, Mayor. We have another question from Michelle S. of Tower Grove Heights. Can you please speak to the current capacity of contact tracing and plans to increase that? Also, can you explain how contact tracing capacity has already been met to support reopening?
Yeah, if it's okay, Michelle, I'm going to bring in Dr. Echols. I'm going to step out of this frame and let Dr. Echols talk with you about contact tracing. It's a very interesting process, and he'll do a better job than I am. So I'll be back.
Hi, Dr. Echols. Would you like for me to repeat the question?
Yes.
Okay. Can you speak to the current capacity of contact tracing and plans to increase that? Can you explain how contact tracing capacity has already been met to support reopening?
So contact tracing is a critical part of the health department's response. So contact tracing isn't something that's new. We do it for other communicable diseases, such as in all outbreaks, as well as sexually transmitted infections. And what it entails is, when we have one case that's reported, we have to identify every contact that that individual has had. So every close contact for COVID-19, we have to identify every close contact that one case has had. And so we reach out to them, we contact them, and then we monitor them for 14 days. That 14-day period of monitoring looks very different now than it did before COVID-19. At this point, the health department has worked with IT platforms that, or IT agencies that have provided resources for us to automate some of the process. So instead of us having to call an individual every morning and evening to obtain their temperature, as well as do a symptom survey, this automated process where we use their telephone number or their email address to get that information from them. So that has saved hundreds of staff hours. But again, that happens each day throughout the course of their monitoring period. So a period of 14 days for those individuals. To increase our capacity, we have leveraged resources within the health department. So we have dedicated communicable disease investigators, as well as HIV prevention staff who have history and knowledge and experience of implementing or conducting contact tracing. And so in total, we have 13 individuals that are focused on contact tracing and communicable disease investigation to help with our effort. And so because we've been able to automate a portion of our monitoring, we've been able to increase our capacity to handle the caseload.
Thank you, Dr. Echols. I have one more question for you at the moment. Can you please speak to the plans to address health disparities that have been exacerbated by the COVID pandemic, particularly those that have worse outcomes because Black residents of North City and North County have been impacted?
I think the key part of your question is exacerbated. So it's been exacerbated by the COVID-19 experience. The first thing we have to acknowledge is that these disparities and inequities are not new. However, we have to do something different. We cannot continue to look at the data and just say, this is the data, but we actually have to use the data to inform the development of new initiatives, new programs that really put the community at the front and center of health. In the health department, we've already started using the COVID-19 situation to actually do that. We are working with non-traditional partners. We've established a new partnership with the St. Louis Area Clergy Coalition, and we're actually expanding that to include other denominations such as Protestant, Jewish, as well as Muslim faith, as well as a few other faith communities, so that we have a full representation on our advisory board. And the goal for the advisory board is to make sure that the clergy can become essentially public health champions. So informing them about what we're seeing at the Department of Public Health and giving them that information so they can provide accurate information to their parishioners.
Thank you, Dr. Echols. Mayor, I think the next question is going to be something for you. So someone who has identified themselves as a concerned citizen in our Zoom call, they want to know how you anticipate bars specifically, but also restaurants, how they can enforce social distancing. You might have 20 people in a bar that normally has a capacity of 50 to 60. What are your guidelines for that?
Well, I think you're absolutely right. I don't know if it's Mr. Concerned Citizen or Ms. Concerned Citizen, but I think you're absolutely right. Bars and restaurants, and frankly, retail and offices are all going to have a much reduced occupancy when they comply with the social distancing. And I know that will be a struggle for some of these businesses, but it's necessary to implement the social distancing. So you're right, you might have a restaurant or a bar that normally has tables packed in and folks kind of, elbow to elbow, and that's, you're not going to be able to have that and practice the social distancing.
Okay. Mayor, I have a question from Kelly M. from the Central West End. Her question is, what process is in place to determine how CARES Act funding is spent in St. Louis City?
Well, thank you, Kelly. So let me talk just for a minute about CARES Act funding. You might know that I think it was last Thursday, the city of St. Louis received $35 million through the state. That's CARES Act 1. And St. Louis County, a week or 10 days before that, had gotten $174 million because they got their money directly from the federal government. So I know that wasn't quite your question, and I'll get to your question, but the city of St. Louis St. Louis County is getting 50% more per person than the city of St. Louis. And that's a troubling situation for us. And we are trying to work with the state to rectify that, because we should be getting 52 or 3 million based on a per capita of about $173 or $4 per person. But anyway, that said, your question was, how are we spending that money? And how are we deciding how to spend it? So the money has some pretty tight guidelines on it. It can only be spent to reimburse us for direct COVID-related expenses. So for example, money that we spend to buy masks, money that we spend to buy test kits, money that we spend to mask, test kits, there's all kinds of things, gowns, medical supplies, money that we spent to house some of the individuals 101 individuals that were unhoused in downtown. We added a capacity of 236 beds to the homeless beds, not just the physical beds, but also the individuals, the caseworkers. We hired folks to do that. So those are some of the big categories of things that we are spending money on right now. We are also planning to spend money on things like utility assistance for folks. Not only is homelessness taking care of someone who's already on the street, but it also has to do with trying to prevent people from being on the street. Also having programs to help small businesses, or help businesses in general, but generally small businesses, restart. We have a program that we'll be rolling out shortly for that. We had one already. It was a smaller program, $5,000. We expect to have another one here shortly. So there are a lot of things that we need to spend money on. Also to spend money to help make sure that we're providing the services that are needed for individuals who need to be tested, individuals who test positive, individuals who, contact tracing. All of those expenses are the kinds of expenses that we can use in order to be use the CARES Act money for.
Thank you, Mayor. We have a question from Kyle of Soulard.
Hi, Kyle.
Kyle says, hello, Mayor. Thank you for the work that you're doing here in St. Louis to get the funds needed from the, to allocate the funds from the CARES Act. However, I know that the money will still not cover the budget shortfall that is anticipated. What services do you believe would be the first to be cut from the budget? Street repairs, refuse, public safety. Thank you.
You're giving me some hard questions there, Kyle. So the CARES Act money actually is not allowed to be used to replace lost revenue. And that's unfortunate. There is CARES 2, which Congress is discussing now, but that's not done yet. And we are hopeful that through CARES 2, we will be able to replace some of the lost earnings tax, the lost sales tax that normally we rely very heavily on to provide basic operations for our city. So what will be cut first? There are very few things that we can actually stop doing. Of course, we need police services. Of course, we need fire services. Of course, we have to pick up your trash. Of course, we've got to cut the grass in the parks. So that is a real struggle for us to think of any one thing that we could totally cut out. More likely, we would make some cuts across the board. We have not done that yet, although that's something that we are anticipating. Let me ask you the question, and I'd love to have your, can we get written responses on this? We can, people can type responses. So if there's something that you think we should cut out, like, do you think we should cut out, somebody suggested to me that we should cut street sweeping. Maybe, although, that puts a lot of dirt into sewers, and that's a whole nother problem. Somebody suggested to me that we should stop cutting grass in parks. I'm probably not going to do that. I don't see how we're going to do that. So why don't you think about some things, and I'd be happy to have your input on that.
Thank you, Mayor. So back to another of our Zoom questions. Stephen Victor wants to know, we're opening bars now. why are we not taking that a step further and going to gyms?
Bars and gyms, they're different. Gyms right now in phase one are closed. And there's a whole spectrum, I know that you all know this, of gyms. There's little boutique gyms, and then there's big gyms with, dozens and dozens of people in them. So the reason gyms aren't opening is that in general, in gyms, you've got a lot of people breathing hard if they're really working out, right? That spews out, potentially germs. You also have a lot of people sweating. That's on the machines. There are lots of machines that are close together. So there's all kinds of issues with gyms and this communicable disease that we have here. So that's why at this point in time, we have not opened gyms. And I know a lot of people are missing their gyms. And, I don't know, the alternatives to that is, working out at home or taking a run in the park, those sorts of things. But I don't think that's like going to a restaurant where people are socially distanced, where folks are generally at a table with their own group, and where you can do a lot of cleaning. So I think that's the issue with gyms.
Here we have a question from Emily of Tower Grove Park.
Hi, Emily.
What is the guidance for summer camps? What should parents plan for? Can summer camps be held respecting the 10-person gathering limit?
Emily, we expect to have some guidance out on that. If you would have asked me 2 days ago, I would have told you we'd have it out by now, but we don't. It'll be soon though. Let's call it day camps as opposed to, sleepover camps that's a whole nother thing. But day camps, childcare is open, but childcare generally is defined for littler kids, kids maybe 6 and under. Camps, the way I think of day camps are, mom or dad or both have to go to work, and they sign their kids up for day camps, which they believe will be healthy, will be enriching experiences for them, but it also allows mom and dad to go to work. So day camps, I think we will figure out how to get those open at some point in time. They do have to, smaller groups are certainly better. Even within a camp, you would want to maintain a small group. And there'll be some activities that you just won't be able to do in day camps, like play soccer, play basketball, some of those sports which are contact sports. It's unlikely you'll be able to do those, but you will be able to do other things. So we are working hard. The CDC had a draft guidelines out for day camps, and then they pulled it back. And unless it was issued today, and I don't, if it has, I'm not up to speed on that, but we are trying to figure out how to allow some day camps to open with restrictions. You want the kids to be safe and you want the employees to be safe, but I know you need day camps.
Mayor, thank you. So Amelia in the Zoom, she's asked a couple of questions, but I think she kind of represents a viewpoint of those who think maybe it's too early to be reopening. What do you say to individuals, whether they're concerned about their employers or just residents of the city, who think it's too early to reopen?
We have been on a stay-at-home order for 8 weeks. And one of the things that is occurring is that we are seeing better numbers day to day, rolling week 7-day averages. And we are also starting to see people defy the stay-at-home order. So easing up a little bit and going slow, we think is the best way to continue to allow some folks to open or to go out, as someone said earlier. But just because you're allowed, your business is allowed to open, does not mean you have to open. I mean, that, I hope. Similarly, for people who have, who are maybe older or have an underlying health condition, they really should continue to stay at home as much as possible, not be out and about and potentially having exposure to COVID-19. So this is a balancing act here of trying to just crack the door open. I know I've used that metaphor before, but crack the door open without swinging it wide open, because this is not This is not the time to party. This is, the time to, okay, now you can go out to eat. Eating outdoors, we understand is considered a little bit better than a table inside. So, it's finally warmed up a little today. So anyway, all of that, I think, is to say that the businesses have a choice about whether or not they open. And as a customer, you have a choice too. And we should all exercise those choices.
Thank you, Mayor. I have a question from Tommy, who says, we now have scooters that are being placed back on the street, and I'm wondering who's taking responsibility for cleaning them.
I just saw the scooters, I think it was this week that they were put back out. If I were you and I were going to ride one of the scooters, I would definitely be carrying the Clorox wipes, sanitizing wipes with me before I got on that scooter. Just like when you walk into the grocery store, there are carts there that you get for your groceries, right? And every grocery store that I've been to recently, there are also the sanitizing wipes there. I take one of those and I wipe the cart off, wipe my hands off, and then go up. So I would definitely suggest, if you feel compelled to ride the scooters, not sure you should, but if you feel compelled to do that, be sure to clean them.
Okay, so we have a question that might be for Dr. Echols.
Good. We'll let Dr. Echols slide in here.
Okay, so what is the plan to determine if or when to increase social distancing measures? What metrics will be used for ongoing surveillance to determine if certain thresholds have been met to reinstate the stay-at-home order?
That's a great question. So there are several criteria that we're looking at. One is the rolling 7-day average, as the mayor mentioned. So we want to see a consistent reduction in the number of new cases that are being reported. We also want to see a reduction in the number of outbreaks that are happening in our jurisdiction. In addition to that, we also look at what we call the R0, which is an objective measure of infectivity. Early on, the R0 for in the city of St. Louis was around 2.5, meaning that for every one person that's infected, an additional 2.5 individuals get infected. And so over the last 2 weeks, the R0 has been around 1, which means for every person that's infected, one person on average gets infected. And so the lower the R0, the better job we're doing at preventing transmission of COVID-19. So implementing those really important measures will continue to be important moving forward. So those are a few of the criteria that we'll be looking at as we move through the COVID-19 experience.
Thank you, Dr. Echols. Mayor, we have another question for you. So this comes from Camden. He wants to know, how are restaurant workers supposed to stay safe with customers not wearing masks when eating or drinking? Is there any sort of guidelines that the city is providing for those restaurant workers?
There are a lot of guidelines. Who is this from? Camden?
Camden.
Camden, there are a lot of guidelines for workers, restaurant workers. Number one, you should be wearing a mask. If you are a server or someone who's working in a restaurant, you're actually required to be wearing a mask. And that is protection for you and protection for other people. Your customers, who come in to eat, should really be walking in with their mask on. Of course, they would have to take it off to eat. We all understand that. Other things are, you should be using disposable menus, or if you have like a laminated menu, you would have to clean that between every customer. Some restaurants have suggested that they are going to say to people to look at the menu on their phone, because this is your own phone and you can look at the menu there. There are a number of guidelines and procedures that restaurants have to use in order to open and in order to continue to stay open. So as someone who works in a restaurant, go on the city's webpage, stlouis-mo.gov. It's right on the homepage. Click on the COVID tab. You'll see it's order number 8. It's Dr. Echols Health Department order number 8. You'll find it. It's right there on the homepage. Go to the section about restaurants and read up on that.
Thank you, Mayor. We have a question from Kelly. What is the city's plan to ensure an accurate and complete 2020 census count, especially in neighborhoods north of Delmar?
Kelly, that's a great question because, for the last 2 months, everything has been COVID. And, that's sort of all we're talking about because we're in a worldwide pandemic. That's understandable. But we have also been working on the census. We have what's called a complete count committee. We had a call just last week with the Secretary of Commerce, Wilbur Ross, because we know that we don't have very good reply rates to the census yet. And so we do have a whole group of people, the census has hired a whole group of people who in the not too distant future will begin calling on people's homes. Now, if you can encourage and just ask people, because everyone's been so consumed with COVID. I got my census, there's a little PIN number in the mail, and I think we did it, my husband did it actually, the first or second day. So I'm in, but if that's still laying around the house somewhere in a pile of mail, dig that out, go online. You can do it on your phone, you can do it on your computer, and fill out your census. It's very, very important for our federal funding. Our federal funding is tied to how many people we have. And so if we don't get people counted accurately, if we don't get everyone counted, it costs us money, which means it costs you service. So we're encouraging everyone to do that. There will be people that'll be door knocking and going door to door over the summer until the end of the census.
Mayor, we have our first question from YouTube. Diane wants to know, can you give us an update on the eviction moratorium? Has that been extended? Will it be staying in place? What do you see happening?
So we expect to see the eviction moratorium extended again. It was first extended through April 19th, I think, then through May 19th. We do know that the Missouri Supreme Court has said that there won't be any jury trials, any court cases until towards the end of June. So we are expecting that no eviction order will be extended end of June, maybe into July. And so we'll see about that in just the next few days to see that extension come through, but we are expecting that.
Thank you, Mayor. We don't have a name for this one, but the question is, will City Hall be open on May 18th for licensing issues and taxes?
City Hall will not be open to visitors on May 18th. We will begin bringing employees back to work. We will still be having a number of people working from home, but City Hall will not be open to visitors on the 18th. Now, most of what you need to do, you can do online. And there will be people in the office to take your calls. There still is a skeleton crew even right now, but on Monday, we expect there will be more people in the office to take your calls. But probably be a couple more weeks before City Hall is open to visitors. And then the visitor experience will probably look different because we can't have a lot of people sort of bunched up in the halls of City Hall waiting to do various procedures. You may have to get a number and wait in your car until, or however. So we're trying to work all that out right now.
Mayor, we have a question from Barb Nelson. She says, we have hundreds of Meals on Wheels clients that are elderly or disabled in the city.
Mm-hmm.
Many of those also have home health workers coming to their homes. What is being done for those workers and clients, whether it's through testing or resources available to them?
So one of the things that we're doing, Barb, is, and this will be starting actually next week, we expect to provide everyone who's getting Meals on Wheels with masks and gloves with those meals so that they can make sure that any visitors that they have are wearing masks. That's already in place. Home health workers are in the healthcare industry and they have to already have to follow infection control procedures. And that includes, of course, masks, gloves, that sort of thing.
Okay.
But I should say that, and Dr. Echols, do you want to talk about the nursing homes? Okay, this is a related question, not quite what you asked. I'm going to let Dr. Echols talk a little bit about nursing homes.
Thank you, Mayor. So one of the challenges that we've become aware of over the last couple of months is the lack of resources that nursing homes and other long-term care facilities have had, which has prevented them from properly implementing some of the essential infection control measures. And so the city is coming together to support them by providing them with masks and hand sanitizer and other resources. In addition to that, over the past couple of months, the health department has went out to long-term care facilities to provide infection control education for administrators and their staff, because the long-term care facilities care for very vulnerable population, so the elderly who are more at risk for experiencing more severe complications associated with COVID-19. So we want to make sure that their residents, so the elderly, are properly protected. We also want to make sure their staff are able to provide those essential services in a safe manner.
Thank you, Dr. Echols. Mayor, I think we have a question for you. This question is from Tommy Bullard. Tommy's question is, can the city begin to close down streets in certain neighborhoods for foot traffic and dining so that folks can get outside and patronize restaurants and socialize from a distance?
Good. What neighborhood does Tommy live in? Does he tell us?
Oh, we just don't know.
We don't know. Okay. Pardon, of Facebook. Okay. Well, Tommy, yes, that's actually something that we've been talking about for the last week or two. And I have a call with aldermen a couple of times a week. We just talked about it last night again. The city is very willing to close down parts of or sections of streets in areas to allow restaurants to expand their outdoor dining, particularly in areas where there might not be enough sidewalk to do that. Also willing to work with them. Some restaurants have a small parking lot or something next door or adjacent to them. And some of the restaurants are proposing to use part of that parking lot for some outdoor dining space. And what we've asked aldermen to do is to get with their business community, because they know their neighborhoods best. Get with their business community, get with the neighbors, make a proposal for what block or what section of a street that business community and that neighborhood will support closing down in order to expand dining. Now, there'll be some limitations. We're not going to let, Kings Highway, Hampton, you think about your big streets, no, but some side streets, some smaller streets where it wouldn't inconvenience people too much to drive in a different way, different direction. As long as the neighborhood and the business community and the neighborhood supports it, the city is going to waive the fees for that and do whatever we can to help those neighborhoods implement that outdoor dining.
All right, Mayor, so we have our first, pretty late in the session, person who wants to ask a live question. So
good.
His name is Raphael Green. We're going to bring him on now. He should be able to unmute himself now and ask a question.
Hi, Raphael. Unmute yourself and then talk to us. I see your name up here, but I don't see you unmuted. Do we have to unmute him?
Hello.
Oh, there he is.
How are you, Mayor? Thank you for taking.
I'm good. Speak up just a little.
I was just able to join the meeting, so you may have already answered this question. I'm a local pastor in the area, and I just wanted to know what the limits are for reconvening with our local church and a suggested time for reconvening.
So churches will be able to open on Monday the 18th for services with many guidelines. You really have to follow the CDC guidelines. But for example, parishioners would have to be 6 feet apart. Now, maybe if it's, two people who are in the same household, they'd sit on one end of the pew. Maybe one person would sit on the other end of the pew and no one would sit behind them. So it would be an every other pew kind of situation. Okay. In a traditional church setup. And I don't know your church, but, there would often in church, there's, you greet people, shake hands, hug. That you really just should not do that. Choirs in church really can't have a big group of people singing together, because singing is expelling a lot of air. What other kinds of things? Those are some of the big things. You have to maintain the social distancing, and people should all be wearing masks in church.
Okay,
So,
thank you very much.
and those are just a couple of the things.
Sure, thank
Mayor, we have a question from Ben M. Don't know what neighborhood.
Okay,
But he
Ben?
says, can you please open the tennis parks at city parks, the tennis courts at city parks, especially at Francis Park? We promised to play 6 feet apart. We 55 and older seniors need the mental and physical activity of our love sport. Thank you.
So it's Ben, right?
It is.
So Ben, on Monday, the 18th, parks will remain open. They've been open the whole time in the city. Playgrounds will be closed, remain closed, and contact sports in parks will remain closed. So what's a contact sport? It's soccer, it's basketball, it's some kind of skating rinks, roller hockey, but it's not tennis. We hope tennis is not a contact sport. So we are hoping to be able to open the tennis courts.
Okay. Mayor, we have a question from Charmin S. This question came from Facebook, and we don't know what neighborhood, but she's asking, when will the city libraries open back up? And do you have any information about the schools?
So that's a great question, Carmen. I spoke, I think it was last weekend, to Waller McGuire, who is the president, executive director, the head guy at St. Louis Public Library. And they are looking at their procedures right now, and they are thinking that they're going to open in early June. He didn't give me an exact date. And, they're looking at how they can open and maintain social distancing and make sure they wipe off their counters. So they are hoping to open in early June. And I know a lot of people are missing their libraries. So no exact date yet, but it'll be a couple, 2-3 weeks yet. Oh, and you asked about education. I'm sorry. So schools, we don't control schools, but the school, we do have an individual in my office. He's the director of children, youth, and families, Will Pinkney, and he's on calls with the schools a couple of times a week. And that's St. Louis Public Schools, as well as charter schools, as well as independent schools and parochial schools, who are all trying to figure out what school reopening looks like. I don't believe there's anybody who's thinking of reopening for summer school, but they are talking about, well, what is it going to look like in the fall, in August? And we all hope that schools will be able to reopen in August, but we just don't know the answer to that question yet.
All right, Mayor, I think we're getting to the last of our questions.
Okay.
I did want to let you know, Jacob is watching from home.
Yeah.
Let us know the library actually did just post their plan on Facebook, so we'll be sure to check that out afterwards.
Okay, good. We'll check that out.
So Mayor, if you want to go ahead and wrap us up and something like
So
that.
thank you all for being on. I think we had maybe 40, I got to put my glasses on to see that. Looks like we have about 42 people on the line. I know that some of you are leaders in your neighborhood, maybe, head of your neighborhood association or organization. And so I hope that you'll carry some of this information back to your neighbors and to your neighborhood organization. We'll do this again in a couple of weeks. I don't know the date or the time exactly. But if you could help us spread the word, please do direct people to our website. We have a lot of information on COVID on our website. And it's pretty important for whether you own a business, run a business, work at a business, that you take a look at those guidelines that we have posted online for the various businesses before Monday or whenever. And the other thing I would say is you got to go slow, guys. We've got to go slow on this. We're trying to let some businesses open. We understand that we can't stay home forever. We know that, but we don't want to see a second big spike, because if we do, we're going to implement restrictions again, and that's going to be very difficult. I mean, it's been very difficult for the last 8 weeks. So go slow. This is a very serious illness. You all know that, but let's not forget that on Monday when some businesses are able to open. Go slow. Thank you all. Appreciate you tuning in tonight. Thanks.